Bismillah ar-Rahman ar-Rahim. This presentation will explain the use of the patient clinical file, which is used as a logbook in the fourth and fifth years clinical courses of oral diagnosis and oral medicine. The important components of the patient record constitutes first the demographic information and the patient chief complaint, the history of chief complaint, past medical history and review of systems, the past dental history, family history, and social history. Now, the second part of the patient clinical file constitutes the clinical findings of the examination, investigations required, preliminary diagnosis, and if not known, we can put down the differential diagnosis, and then the treatment plan. And if the patient is going to be reviewed, for example, due to the persistence of oral lesions, or because we are going to follow up the drugs prescribed to this patient, and so on, we have here a section for the review visits. We always divide the patient clinical record into two main parts. The first part, which is the part of the history, is actually the information that are obtained from the patient. So this means that the demographics, the chief complaint, and the patient history should all be obtained from the patient and should be in the patient's own language, especially the part which concerns the chief complaint and the history of the chief complaint. The second part of the patient record is actually the examination or the clinical part, which is usually done by the operator or the practitioner or the student. This part, the last part, which is the treatment plan, referrals, and diagnosis, should be actually, or this decision should be obtained by dialogue between the patient and the physician or the practitioner. Let's start first with the first part, which is the patient history. So we will explain each one of these and how it is written. First, let me start by saying that the patient clinical file or the patient record, this confidential piece of information can be conducted in two or three ways. The first way is in the form of a pre-prepared form which is given to the patient during waiting for their appointment, and the patient will complete this questionnaire or will complete this form to be later seen and discussed by his practitioner. The second method for obtaining the patient history is through face-to-face interview or direct interview with the patient. Of course, direct interview with the patient will get you more accurate information about the patient. So sometimes we can combine both methods by first asking the patient to fill out or to complete this questionnaire alone, and then once the patient is seen in the dental practice, we can discuss, the practitioner can discuss the information present in this file. Anyway, the For you as students, you will use the second method, which is the direct interview with the patient. The first part of this file consists of demographic information. So we have here the patient name, the patient age, gender, education, occupation, and phone number. Of course, these demographic information are very important because it will give us an insight about some clinical problems that the patient may have, which may be related to the age. For example, in children, we have different diseases, we have different problems for elderly patients, also for middle-aged patients as well. Also, there are some gender related issues that also should be clear in the patient record. Education and occupation also are relevant in certain areas because we have certain occupations that may jeopardize oral health or may be related to the quality of life or oral health quality of life. And of course, the phone number is very important for communication with the patient. So after writing down these information, we will go to the chief complaint, which is the reason why the patient attended the clinic. Usually, or the most important or the most common cause for patients to seek help is pain, whether this pain is odontogenic or in the periodontal tissues or in the face and so on. So that's why it's very important to specify the main cause for attending the clinic, so that we can take the appropriate and thorough history about this chief complaint. So in this area, you write down the chief complaint. For example, the patient may say, I have pain in the lower jaw or the right side, or I have pain in a specific tooth, or I would like to have a prosthesis, or I have missing teeth and I need a replacement, or my tooth is mobile and I want to remove it, or I have bleeding from my gingiva, or I just want to clean my teeth. Sometimes the patients do not have a specific oral problem, rather they would say that I would like to check up my teeth or my gums and so on. So if there are no problems, the patient can request, or the chief complaint can just be a regular checkup. So there is usually one chief complaint, and there could be other complaints. However, if there are more than one problem the patient has, then you write down them in a specific order, starting by the main or the chief complaint. And then we go to the history of the chief complaint. The history of the chief complaint is actually the history of, for example, if the patient complains about pain, then we need to ask specific questions about this pain. For example, we can start by asking the patient about the onset of pain. When did this pain start? Where is it located? What are the stimulating or the initiating factors? And what are the relieving factors? Does it disturb sleep? Is it intermittent or continuous? Have you used any medications to relieve it? Have you gone previously to any dentists in order to relieve this pain, and so on? If the pain or if the chief complaint is about, for example, bleeding from the gingiva, again, you ask what causes this bleeding? Is is it spontaneous, or is it, for example, during eating, during teeth brushing, and so on. So you ask specific questions about the chief complaint, and you write them all in this area, the history of chief complaint. The third main component of the patient history is the medical history. The medical history is very important because it gives us an insight about any medical problems the patient may have, and these may influence the dental treatment plan. For example, hypertensive patients, patients with heart failure, patients with renal disease, liver disease, patients on, for example, certain medications like corticosteroids, like anticoagulants. All of these patients may need modifications in the dental treatment plan so as not to, or so as to avoid risky or potentially risky dental treatment. So the medical history will mainly constitute two parts: the past medical history, for example, previous hospitalizations, previous exposure to general anesthesia, previous allergies or in history of allergies, and so on, because these again may have implications. In the current medical history, you will also consider taking notes on the patient's current medications. When you write down the patient's medications, you should note that we try as much as possible to write the generic name of the drug, not the trade name. So you write down the generic name and the dose. This is very important. On many instances, the patient does not memorize the names of the medications they are taking, so you should request them to bring the names or the list of medications they take on the next appointment. After the medical history comes the past dental history. Now, the past dental history may have these scenarios. First, the patient may be of the type that doesn't look after their teeth, or they do not attend, or they do not visit the dentist. So you may write down that this is the patient first visit. However, if the patient has received any dental treatment in the past, so you write them in general. You don't need to be very specific, like, for example, writing the patient has done and composite filling for the lower left 6 and has extracted upper right 3, and so on. Instead, you should write down the treatments in general. So the patient may have received dental extractions, may have had crown and bridge work, may have had scaling, fillings, and so on. So the past dental history is written. All sorts of dental treatments are written here. However, you don't need to go into details. After the dental history, we go for family history. And the family history here is concerned with mainly communicable and hereditary diseases. Again, because these may have implications on the patient's medical history and also on the dental treatment plan. So what are the types of communicable and hereditary diseases that may be of concern to us? These are, for example, like the cardiovascular diseases, like ischemic heart disease, like, for example, cancer, like hepatitis, like HIV, and so on. So these communicable and hereditary diseases are of concern to us, and these should be written down here in the family history. So you may write down the patient has hypertensive father, a mother with breast cancer, for example. Um, uh, for example, uncle has or grandfather has viral hepatitis, and so on. After the social history, we will discuss, after the family history, we will discuss the social history, which is the last part of the patient history. The social history is consists of any habit that may have a harmful effect or an adverse effect on oral health. So we have here parafunctional habits, we have smoking or tobacco use, and we have oral hygiene habits. All of these are actually discussed within the context of social history. So the meaning of parafunctional habits is the habits that actually in which the patient uses the orificial complex in a way that is damaging or that is destructive. This may have damaging effects on the teeth, for example, or in the soft tissues. For example, patients who have tongue thrust, patients who have lip biting or cheek biting, patients who eat rough foods that may also destruct the teeth. Patients who have bruxism or grinding, again, this may be destructive to the teeth and to the TMJ complex. So, as I said, in this part, we will write down all the parafunctional habits that the patient may have, because these will need to be addressed in the treatment plan, and these may have actually a correlation with the patient's chief complaint. The second part of the social history is smoking or tobacco use, and also alcohol use. In the tobacco use part, it's very important that you specify which type of tobacco the patient uses. So if it is cigarettes, we will write down the patient smokes cigarettes, for example, one packet a day for the past 5 years, and also, for example, if he uses argile, or if he uses pipe, or chews tobacco, and so on, it's very important that you write down the type, the onset, and the quantity. And if the patient uses alcohol, again, we write down that the patient drinks alcohol, but it is a mistake to write down that the patient is alcoholic, because alcoholic patients are different from patients who use alcohol. The last part of the social history is oral hygiene habits. Again, oral hygiene is considered a social habit. Therefore, it's very necessary that you write down details about what oral hygiene habits the patient uses. Now, if the patient says, I have good oral hygiene, you don't write down here that the patient has good oral hygiene, because good oral hygiene, you judge if the patient has good oral hygiene or not, because the patient may say that they brush their teeth 3 times a day, however, they don't use the toothbrush properly, and eventually there is gingivitis. So you just write down if the patient uses the toothbrush occasionally, once daily, twice daily, if the patient uses dental floss, if the patient uses mouthwash, if the patient uses other auxiliary oral hygiene aids, like, for example, miswak, and so on. You write down these in the section of the oral hygiene habits. So this is briefly the patient history. And after completing or taking these data from the patient, you will start doing the oral examination. And we will post another video about oral examination and also the required investigations and the treatment plan. And this is going to be the next video for you. Good luck, everyone, and have a nice day.